initial investigations, the ECG showed ST segment depression in leads V4 and V6. This represents subendocardial ischemia, commonly seen in STEMI or unstable angina. Cardiac biomarkers showed open in one elevation, confirming myocardial injury. Based on clinical presentations, ECG and biomarkers, a diagnosis of non-ST elevation myocardial infarction was made.
So here we noted the point that is ST elevation, ST depression noted in V4 and V6 and biomarkers troponin get elevated. So these things also confirming there is a presence of angina, ischemic heart disease. And next point now we'll see the role of echocardigraphy in ischemic heart disease. Here
echocardigraphy is invaluable in ischemic heart disease because it detects the regional and global myocardial dysfunction, which helps to differentiate the ischemic from non-ischemic cause of LV dysfunction.
So here in this video we can able to differentiate and find out ischemic heart disease. So we want to focus it on more in regional valve motion abnormalities and global functions of LV, and
which identifies the mechanical complications of the myocardial infarction, and it also assists us in prognostic assessment.
Okay. So in early ischemia, the LV may be appeared as a normal, and however here is a prolonged ischemia. So LV is appeared as dilated ventricular remolding size, which is dilated. Globular dysfunction also will be noted. And where is ischemic heart disease, whether which artery get occluded, we have to find out it. Okay. And here the LV remolding includes LV dilatations, elliptical shape to spherical shape, which is changing of LV shape, and thinning of infracted myocardial segments, which is whether inferior wall get infracted or anterior wall get infracted, there is thinned out and akinetic will be appeared. And LV dilatation signifies a chronic ischemic damage, and it is also associated with some reduced cardiac efficiency and poor prognosis. And regional valve motion abnormalities are
the most sensitive and specific echocardiographic marker of ischemic heart disease is the presence of the regional valve motion abnormalities. Normally, all the myocardial segments contract synchronously in this era. Hypokinesia occurs due to the reduced ATP availability.
Due to contractile function is lost, and another one is dyskinesia. That is
due to the infracted myocardial bulging outward during the systole.
Okay.
These abnormalities corresponded due to the coronary artery territories. LAD, LCA and LCX. LAD anterior wall, septum and apex. RCA inferior wall and LCX lateral wall.
So it has appeared within the seconds of ischemia, which is often before ECG changes become evident. So global LV systolic function is quantified by using ejection fraction values. Here the normal AF is about
55 to 70%.
Okay.
Mild dysfunction is about 45 to 54%.
Okay.
And moderate dysfunction is about 30 to 44%. And severe dysfunction is about lesser than 30%. In ischemic heart disease, EF reduction reflects extent of myocardial damage. A lower EF is strongly associated with higher mortality, heart failure, sudden cardiac death.
The another one is diastolic dysfunction. It is often the earliest manifestation of ischemia, ischemic heart disease. So ischemia impair the myocardial relaxation, leading to a delayed LV filling, increased LV and diastolic pressure, and pulmonary congestion. So pressure get increases, LA pressure get overloaded, no? So pulmonary congestion. So here the patient may develop with the dyspnea. Even with the preserved EF, so we are highlighting the importance of diastolic assessment. Ischemia also affecting the papillary muscles to adjustment of myocardium, resulting in function of mitral valve regurgitation. So here the echo findings included a restrictive leaflet motions, poor leaflet coaptation, which is LV, in mitral regurgitation there is a poor leaflet coaptation. Regurgitation jet on color Doppler. So ischemic MR worsens, LV volume overloaded. In marker of severe ischemic heart disease. Echocardiographic findings for this patients are kind of little different. We'll discuss about it.
In this patient, inferolateral valve showed hypokinesia.
Hypokinesia.
Left ventricular ejection fraction was 40%, indicating moderate systolic dysfunction. Mild ischemia mitral regurgitation was present. Grade 1 diastolic dysfunction was noted. So the final diagnosis are ischemic heart disease presenting as NSTEMI with regional wall motion abnormality, moderate left ventricular systolic dysfunction, and early heart failure features.
This was the detailed case study about a patient who is suffering from ischemic heart disease, and the summary are.
So for the summary, we saw this patient who is a 58-year-old male. So observing his symptoms and history, we ran a bunch of investigations and several echo assessments. And through all of that, we came to a conclusion that the person was suffering from inferior lateral MI along with a mild LV systolic dysfunction. Also has a EF of about 40%. Thank you.
So mild to moderate LVD systolic dysfunction, and the EF is about 40%, which also leads to future for heart failure due to elevated chamber pressures also in left heart. Thank you.